Well, considering a Medicare plan is one of the most important decisions a person can make, not only for their well-being, but also for their wallet. Now, here with some tips on how people can make the best choices about their Medicare coverage is Chris Abbott from United Healthcare. Chris, thank you so much for joining us.
Thanks, Alex, for having me on.
Of course, and you know, this time of year we're always talking about this, and it's a very important topic. So let's start with the basics. When is open enrollment, and why would you say it's important?
Well, we have started the Medicare annual open enrollment period, started October 15th. It will run through until December 7th, so this is the window. All 58 million Americans who are on Medicare today have a chance to make sure they have the right plan for 2018. I always recommend that people take the opportunity to shop a little bit. If you're on a plan today, you would have received a packet of information over the last couple of weeks. Take a look and see if that plan continues to work for you. The plan may have changed a little bit. Things in your life could have changed, so make sure that continues to be a good match. Looking at the budget, the financial aspects of the plan is as important as well. That plan needs to fit not only your clinical needs, but it needs to fit your wallet. Lots of times people look immediately at the premium, and that's the only thing that they judge. But I recommend look at the cost sharing. So is there a deductible? How do the copays fit with your wallet if you need to access care? The next thing I always recommend people do is make sure the medications that you're taking are part of the plan. So whether you have a Medicare Advantage plan or you have a Medicare Part D, you're reviewing those medications, making sure you've got access at the most affordable level. And then last but certainly not least is validate that the physicians and hospitals you prefer to use, you're going to have access to with that plan. Again, people want to maintain the continuity of relationship with a doctor or hospital, so that's another key element to check.
Right, and so talk to us a little bit about the difference between original Medicare Advantage.
So original Medicare, Medicare Part A and Part B, been around now for over 50 years. Most people gain access to Medicare Part A as the hospital portion. Medicare Part B is the doctor or outpatient portion as they turn 65. People do pay a premium for Part B. But one of the things that's important to remember is there's always cost sharing with Part A and Part B, and those are without limit, and they can be very, very significant. Medicare Part C then is the other way for you to get your Medicare benefits. Medicare Part C plans, Medicare Advantage, are offered by private companies like United Healthcare that have a contract with the federal government. We take A and B and put them together into a single program. We're typically building in the prescription Part D benefits, so you've got everything in one simple, convenient package. And again, the advantage part of Medicare Advantage continues to be is we're first going to provide financial protection to protect your wallet, but also adding those additional benefits. So things like a fitness club membership is an important part of the benefits we offer at United Healthcare. Coverage for hearing aids, dental coverage, coverage for eyewear are all options you should be looking at. If you need those things, look at a plan that provides those kind of services.
Well, there's so much information to absorb and so many different options. If people want to learn a little bit more and get some more resources, where can they go?
Well, if you want to learn more about the portfolio of United Healthcare plans in the Tucson area, you can actually go online right now, uhcmedicareplans.com. You can also give us a call, 1-800-UHC-6509. We're happy to connect you with an agent in the local area there to make sure you've got the right plan for 2018. Or if you'd like to shop a little more broadly, you can actually check out the government site at medicare.gov.